Department of Topographic and Clinical Anatomy named after Professor N.A. Klopov. Today's topic is operative surgery of the abdomen. Abdominal cavity is the space covered by the intra-abdominal fascia, divided superiorly by the diaphragm, inferiorly by the boundary line that separates the abdominal cavity from the pelvic cavity. At the superior border, the abdomen is bounded by the costal arches, inferiorly by the iliac crest, inguinal ligaments, and the superior edge of the pubic symphysis. The lateral border of the abdomen runs along the vertical lines connecting the ends of 11 ribs. The abdomen is divided into 3 sections by 2 horizontal lines: the foregut, epigastrium, midgut, mesogastrium, and hindgut, hypogastrium. The external borders of rectus abdominis muscles are run from top to bottom and divides each section into 3 areas. Anatomy of the peritoneum. Peritoneum is a thin serous membrane covering the inner wall of the abdominal cavity. It divides into parietal and visceral. The abdominal cavity is a cavity lined with the parietal peritoneum. In men, it is closed. In women, it communicates with the external environment through the opening of the fallopian tubes. Peritoneal cavity is the cavity between the parietal and visceral layers of the peritoneum. Parietal peritoneum line the walls, and visceral peritoneum covers organs from all sides. Intraperitoneal from 3 sides, called mesoperitoneum, and from 1 side, extraperitoneal. Properties: it is elastic, responsible for fluid release and absorption. Receptor, acts as a blood deposition, bactericidal function, and biological adhesion. It also reduces the friction between organs, acts as a protective function and conductive function. Abdominal sections: there are 2 sections, superior and inferior part. The boundary between the 2 parts is the transfer colon and its mesentery. The right lobe of the liver, part of the gallbladder, hepatic flexure of the colon, the right adrenal gland, part of the right kidney are projected into the right hypochondrium. Left lobe of the liver, part of the gallbladder, part of the gastric body, and pylorus projects into epigastrium. The upper half of the duodenum, gastroduodenal junction, pancreas, part of the right and left kidneys, aorta with celiac trunk, celiac plexus, and small area of the pericardium, and inferior vena cava. The fundus, cardia, and part of the body of stomach, spleen, tail of the pancreas, part of the kidney, and left lobe of the liver are projected into the left hypochondrium. The ascending colon, part of the ileum, part of the right kidney, and the right ureters are projected into the right lumbar region of the abdomen. The umbilical region includes greater curvature of the stomach, transverse colon, loops of the jejunum and ileum, part of the kidney, aorta, and inferior vena cava. Left lumbar region of the abdomen includes the descending colon, loops of the jejunum, and the left ureter. Right inguinal region includes the cecum with the vermiform appendix and the terminal ileum. Pubic region includes the loops of the jejunum and ileum, the gallbladder, and a filled state, parts of the sigmoid colon, transition to the rectum. The left inguinal region includes the sigmoid colon and the loops of the jejunum and the ileum. The uterus does not normally protrude beyond the upper edge of the pubic symphysis, but during pregnancy, depending on the due date, it can be projected into the suprapubic umbilical or epigastric region. Peritoneal folds. The linea alba of the abdomen, formed by the interlacing of tendon fibers, aponeurosis of all 3 pairs of broad abdominal muscles. It stretches from the xiphoid process to the pubic symphysis, has a length from 30 to 40 centimeters, width is different. Xiphoid process is 0.5 centimeters, then it expands at the level of the umbilicus 2-3 centimeters, Thickness above the umbilicus is 1-2 mm, below the umbilicus is 3-4 mm. In case of increasing of the abdominal pressure, the tendon fibers of the tissue line stretch and move apart, leading to the formation of weak points. Hernias of the linea alba are more common above the umbilicus, where it is thin and wide. The peritoneum of the upper abdominal section covers the internal organs and forms 3 bags: hepatic, pregastric, and mental. The blood supply to the upper floor of the abdominal cavity is provided by the abdominal part of the descending aorta. At the level of the lower edge of the 12th thoracic vertebra, aorta branches to the celiac trunk, which almost immediately divides into its terminal branches, the left gastric, common hepatic, and splenic arteries. The left gastric artery supplies cardiac parts of the stomach and placed on the left half of the lesser curvature. The common hepatic artery gives off branches to supply the duodenum, the gastrointestinal duodenal artery, to the stomach, the right gastric artery, and then passes into the hepatic artery itself, which supplies the liver, gallbladder, and biliary tract. Splenic artery passes horizontally to the left of the spleen along the path of the short branch of the stomach. Nerves and the nerve plexuses. The innervation of the upper part of the abdominal cavity is carried out by the vagus nerve, the sympathetic trunk, and the celiac plexus. Along the entire course of the abdominal aorta is the abdominal aortic plexus, formed by the sympathetic and parasympathetic branches. At the point of origin of the celiac trunk from the aorta, celiac plexus is formed, which gives off branches spreading along with the branches of the celiac trunk. As a result, organ nerve plexuses are formed near the organs, that is hepatic, splenic, and renal, which provide innervation to the corresponding organs. At the origin of the superior mesenteric artery, the superior mesenteric plexus is located, which is involved in the innervation of the abdomen. Derivative ligaments of the peritoneum. From the ventral mesentery is the ligament of the liver. Derivative of the dorsal mesentery is gastrocolic. Overgrown vessels, round ligament of the liver. Longitudinal incisions. Number 1, upper middle. 2, paramedian. 3, transrectal right and left. 4, pararectal right and left. And 5, lower median. Cross, oblique, and combined incisions. First is paracostal cochlear incision. Number 2 is thoraco-abdominal. Number 3 is rheobranchial corner incision. Number 4 is the incision by Volkovich-Diakonov. 5, suprapubic. Number 6 is lower transverse. Number 7 is oblique hernia repair. Appendectomy incisions. Number 1 is Alecto-McBurney-Volkovich-Diakonov incision. And number 2 is vertical according to Lenander. Thank you for your attention.